First, I'm honored to be a part of this first MENA meeting in neurology, and I would like to thank warmly BD Factory for this kind of invitation. Today, I try to discuss with my friend and brother Noor, 2 centimeter size is the URS the winner. But I hope to add a subtitle for this presentation. Is there any offers from URS for 2 centimeter stone size? First, I have this question for my friend Noor. You see this slide? I ask you when and where this photo is taken. I need your answer at the end of the presentation, please, and we will win something. So we start with this quote from quotation from Albert Einstein: "In the middle of difficulty lies opportunity." Today we try to manage our big stone. As you know, in 2020, what is the best attitude face to face with the stone? Before taking decision, we have a lot of questions to ask ourselves: is stone volume or size or location or shape or X-ray characteristic? However, no open surgery is indicated when SWL, flexible or percutaneous fail or unlikely to be successful. So nowadays, the open surgery is still widely practiced in our countries, and you see in this picture the big and hard stone in this slide. And now together we will ask us what is our best choice, the right picture or the left picture today with my friend Noor. As you know, the endoscopic procedure has revolutionized the treatment of renal stones, give us benefit from technological advances, and we have benefit about day surgery procedures and mainstay of treatment. And we have a better resolution, fidelity, and the quality and utilization of instruments too. In the market, as you know, we have a lot of devices, and we have a lot of there as laser our ballistic devices to fragment our stones. We have a large choice in 2020. For us in Algeria, I hope to spotlight what happened in our region. It is important today to share with you our experience, our point of view. The first laser use was during the first academic day, during the first Indological Day in February 12, 2012, in my home city in Algeria with Professor Olivier Taxel. It was 8 years ago. So for 2 centimeter stones, what can offer? Certainly we have PCNL, and we have to ureteroscopy and as well. Each procedure has a complication, as bleeding for PCNL or perforations are the most important risk factor for complication for URS. This is what all the papers show us during this last decade. But this paper is very interesting from Olivier Taxel and team. Show us the renal parenchyma injury after PCNL. And for 30 French standard PCNL, we have 0.91%, and for 11 French, we have 0.63%. Some papers to help me to defend my point of view today with my friend Noor. This study from Olivier Taxel team show us the treatment of the stones between 2 and 3 centimeters. Certainly, it was the success rate was 63.1% for the first session procedure and 34% fragment, but it requires more procedures in this way. The second paper for 2 centimeters PNL from France 2 show us the efficacy of PNL for this study, and no fragment after 3 months post-operatory. At the same time, some work from India, Janak Desai team, show us approximately we have the same percentage of stone-free rate for URS and percutaneous. For the first one, it was 94%, and the second one, 97.4%. And the graph at the below show us the stable evolution of PCNL in the red one, and the growth, the slowly growth of URS in the yellow one. This paper about URS versus PNL to compare the two procedures conclude that URS is an effective and safe alternative to treat this kind of stones, but it is advisable to balance the benefit and the risk for each procedure and the individual characteristic of patients. And we should decide with patients by discussing the advantages and disadvantages of each procedure. I would like get behind this. The two last points, they are very important for us in our region. About retrograde intrarenal surgery, this study gives us the outcomes and the safety of retrograde intrarenal surgery for the treatment of the 2 centimeter size, where they conclude this procedure is safe and effective modality for treatment of renal stones, and they performed as a primary operation in this kind, and the stone-free rate was 64% in this procedure, and should be used as primary mode of treatment for stones. Now, the study compared the two procedures for 2 centimeters for 106 patients. 85 underwent the PCNL and 48 received ureteroscopy, where the ureteroscopy is an efficacious method for treating renal stone, and the operating time is shorter in the PCNL, as Noor said. But the blood loss was significantly higher in PCNL. It's very important to notice that. So the stone-free rate for the first one is 28%, and the second one 87%, and the hospital day were significantly shorter in the URS. This is important too for us. But the both procedure can be friend as me and Noor. And this paper confirmed this combined URS published for 4 years ago. But today, the important question is for us to discuss: what would the appropriate treatment choice be for our patient in 2020? Is just the guideline, we should put the guideline and go ahead, or we discuss together with patient the protocols, or we discuss the technical platform, the available equipments, or the competence or the expertise of the surgeon. But the main important point for us today in our region, the patient, because we should discuss the available financial resources for our patients, the insurance, and we have no insurance in our country for operating operations. Or finally, we can explain the problem for the patient, and for some reason, and we orient the patient to another center. And why we favor one treatment over the other? Is the guidance for trainers, or the local availability of treatment, or the enjoyment of operating, or the healthcare system, or the health economics of our region or our country? I totally convinced that the successful management of the all aspects of stone management is competence and equipment. The word equipment equals what? Money. The cost of each procedure is important to know. From Canada, we have two prices for the as well is more than $2,000, and for personnel is more than $4,000. The second study from North Ireland, URS is 1,350 pounds. Is a little bit expensive, and in Algeria, I'm sorry, no study yet, but I can give you some orientation about the prices, the cost of each procedure for PPNL between 1,500 and 2,000 euro, and for URS is for 1,000 euro, and as well between 300 and 400 euro. In practice, I would like to share with you this recent case, 2020. I do it a few weeks ago. This man, 56-year-old, with 3 stones, 20, 11, and 13 millimeters. The density is between 1,230 and 1,135. I discussed with the patient all the procedures. I proposed to him the PCNL, but he refused. And the last word is for the patient. For some reason, for him, and the patient choose the URS, and performed the URS, and it was successfully in this case. My take-home messages. Certainly, the surgery is moving to the minimally invasive surgery. We can combine both procedures, and we have a lot of devices to choice. And the future is to the miniaturization of the instruments, and the stones not getting smaller. In our region, the stones are big and hard stone. This is the difference between us and other countries through the world. And we try to work with the shorter hospital day and less pain with MES. And we can discuss on the multitude papers now and in the future the stone free rate for each procedure, and the evolution follow us. And the important point is to inform the constant thing for the patient, and the time will tell us about the durability of the instruments and the choice between the two procedures. The second take-home message for me, we try through our association and through POSA Association, Pan-African Association, to develop in our region the urological spirit, OPPD. It's very important to develop this way to follow the technical evolution and the devices through the world. O for observe, P for practice, P for progress, and then every young urologist can develop his skills. And as you know, to conquer all things, we have energy and persistence. This is our motto and our aim in the slide. And the door of wisdom are not shut to discuss the bout procedure with my friend Noor. This is my last slide.